If a stroke starts in your living room tonight, you have about 3 minutes before brain cells begin to die, not hours, minutes. Every 40 seconds in the United States, someone has a stroke, and when blood flow to the brain stops, nearly 2 million neurons die every single minute. But here's what most people don't realize. There is something you can do immediately, before the ambulance arrives, that may reduce damage and improve survival. And the most dangerous mistake? It usually happens at night. Stay with me. A stroke happens when blood flow to part of the brain is interrupted, either by a clot blocking an artery, ischemic stroke, or a ruptured vessel causing bleeding, hemorrhagic stroke. In both cases, brain tissue is starved of oxygen and glucose. Without oxygen, neurons switch to emergency metabolism. Lactic acid builds up, cells swell, inflammation explodes. The surrounding tissue, the penumbra, is still salvageable, but only briefly. That window is where your actions matter. I'm Dr. Robert Anderson. After decades treating vascular disease and neurological emergencies, I can tell you this. What happens in the first 3 to 5 minutes often determines whether someone walks again or doesn't. So let's talk about what to do immediately. But first, you must recognize the warning signs. And number 3 is the one most patients ignore. Step 1. Identify it fast. Don't hesitate, use the FAST test. F. Face drooping, ask them to smile. Does one side sag? A. Arm weakness, have them raise both arms. Does one drift downward? S. Speech difficulty, slurred, confused, can't find words? T. Time to call 911. And here's what surprises most people. Even if symptoms disappear after a few minutes, it could be a TIA, a mini stroke. That's not harmless. It's a warning shot. Up to 1 in 3 people who have a TIA will have a major stroke within a year, many within 48 hours. Don't wait to see if it passes. Call 911 immediately, not your neighbor, not your primary care office. 911, because paramedics start treatment en route and route you to a certified stroke center, and that saves brain tissue. Step 2. Position the body correctly. While waiting for help, positioning matters. If the person is conscious, lay them down flat and slightly elevate the head about 30 degrees. Why? Because excessive elevation can reduce blood flow to the brain, but lying completely flat increases aspiration risk if they vomit. 30 degrees helps maintain cerebral perfusion while protecting the airway. If they become nauseated or drowsy, gently turn them onto their side, the recovery position, to prevent choking. Do not give food, do not give water, do not give medication. And here's a common mistake I've seen families make: giving aspirin just in case. That can be dangerous. If it's a hemorrhagic stroke, a bleed, aspirin worsens bleeding. You cannot tell the difference at home. Let the CT scan decide. Step 3. Control panic. Lower the stress surge. This is the part no one talks about. When a stroke begins, the body floods with stress hormones, adrenaline and cortisol. Heart rate rises. Blood pressure spikes. That spike can enlarge the area of damage. So your job is simple. Keep the environment calm. Speak slowly. Reassure them. Limit stimulation. Don't argue. Don't shake them. Don't test them repeatedly. Every spike in blood pressure can worsen bleeding or push a clot further. Calm equals protection. And here's what often makes things worse: trying to rush them into a car. I understand the instinct, but driving them yourself delays treatment, increases risk during transport, and bypasses pre-hospital stroke protocols. EMS can start oxygen, monitor heart rhythm, check blood glucose, and alert the hospital stroke team before arrival. Minutes matter. Mid-video, here's the critical nighttime risk. Now remember earlier I mentioned the most dangerous mistake happens at night. Here it is. Many strokes occur during sleep. The person wakes up confused, weak, or unable to speak, and families assume they're just groggy. They wait. Morning comes. The golden window closes. For ischemic stroke, clot-busting medication, TPA, is typically most effective within 3 to 4.5 hours from symptom onset. If you don't know when symptoms began, eligibility becomes complicated. If someone wakes up with symptoms, treat the time they were last seen normal as the start time, and call immediately. Never wait for breakfast. Never wait for daylight. Step 4. Check blood sugar. If possible, Low blood sugar can mimic stroke symptoms, slurred speech, confusion, weakness. If the person has diabetes and you have a glucose monitor nearby, check it quickly while waiting for EMS. If glucose is extremely low and they are conscious, you may give glucose tablets. But if you're unsure, or they're unconscious, do not put anything in their mouth. Again, airway protection comes first. Step 5. Note the time. This sounds simple, but it's critical. Write down the exact time symptoms started, or the last time they were seen normal. That single detail determines eligibility for clot retrieval procedures, thrombolytics, and advanced interventions. I've seen patients miss life-saving treatment because no one documented the timeline. Time is brain. Literally. Now let's close one of the earlier loops. Why do neurons die so quickly? Because brain cells have almost no energy reserves. Unlike muscle or liver tissue, they cannot store significant glucose or oxygen. When blood flow stops, ion pumps fail. Calcium floods into cells. Toxic excitatory neurotransmitters like glutamate accumulate. It becomes a cascade. That cascade can spread beyond the initial blockage. But early restoration of circulation can halt it. Which is why everything we've discussed centers on speed. And here's something else most people don't expect. Stroke risk is often silent. High blood pressure slowly stiffens arteries. Atrial fibrillation allows clots to form in the heart. Uncontrolled diabetes damages the inner lining of blood vessels. High LDL cholesterol builds plaque inside carotid arteries. You don't feel plaque growing. You don't feel atrial fibrillation forming clots. Until suddenly, you do. That's why prevention matters just as much as emergency response. Control blood pressure below 130/80 when possible. Manage blood sugar aggressively. Treat atrial fibrillation appropriately. Stop smoking. Move daily. These are not suggestions, they're brain preservation strategies. Let me leave you with this. If stroke symptoms appear, your role is not to diagnose, your role is to act. Recognize fast. Call 911. Position safely. Keep calm. Document the time. And never wait for symptoms to improve. Because while you're waiting, brain cells are dying. In our next discussion, I'm going to explain the subtle early warning signs, weeks before a major stroke, that most seniors dismiss as just aging, and that may be the most important conversation of all.